Hi, Dr. Lindsey here. This brief video will take you through a short scar facelift that I did on a 73-year-old. I first worked on this lady back in 2005, so what's that, 19 years ago, so she would have been 54 at the first surgery that we did, which was a short scar facelift. Here she is before, and then here's about a week. And then I had the occasion to see her at 5 years with a different hairstyle. Looks like a different lady actually, but her neck and jawline have held up well. Now fast forward 19 years to this year, and she's 73, and so what happens when you get older is you lose 1% of the stuff that holds you together per year. And so you may sag more, but you have to be careful when you pull. The tissues aren't as strong and resilient as they were when a person's 50. And so, again, we just did a short scar facelift under local anesthesia. She has an ophthalmologic condition that prevents me from doing anything to her eyes. So here she is before the procedure, and then here's a video on the post-op day 1. Hey Josie, how old are you, ma'am?
73.
And I worked on you back in maybe '05 or something like that. And yesterday we did a little short scar facelift.
Right.
How much did it hurt last night?
Not bad at all.
Now, you know.
Today it's fine.
I'm going to just spin around here. I've known you for a long time. Any kind of bullshit I've ever pulled on you?
No.
Okay. All right. And, you know, we were just talking about you're the perfect person for something like this. You don't need a whole lot done. You've got a great chin and you have a skinny features. I really appreciate you coming in. We'll do another little video in a week. Thanks.
Okay. Thanks.
And then on post-op day 6, she does a second little video. So now it's been 6 days, right?
Right.
And how much pain and suffering did you have this week?
None. A little bit of pain, but
okay.
Nothing horrible.
And I'm just going to spin around and show your incisions at day 6. And they're a little pink, and they'll, as you would probably remember, they'll get a little pinker for a couple of weeks, and I'd like you to take a little vitamin E and put on there.
Okay.
And expect the incisions to get a little worse for about 3 or 4 weeks, and then they'll fade. Ideally, you come back and see me in a couple of weeks, but you've been through this before. If you have any trouble, track me down. Anything you want to tell somebody that's looking at this?
Do it. It's really worth having it done.
And it is refreshing, but it's not over the top, right?
No. Actually, I met someone yesterday that lives next door, and she didn't even notice anything was done. She said, "I like your haircut."
Yeah,
so
people fall into 2 groups. Some people love that nobody noticed they did a bunch of stuff. And occasionally people say, well, you know, nobody noticed. But the idea is just to make you look more refreshed.
Right.
Okay.
That's it.
All right, thank you so much.
Mm-hmm.
So in summary, for a thin person with angular features who doesn't need a complete makeover, a short scar facelift really can do a lot in a little bit of time and very safely. I've done about 4,400 of these type procedures. Had no major complications such as paralyzed face. Downtime is typically about a week because you have to wear a head wrap during the first week to hold things into place. But generally at a week, you can do pretty much whatever you want to. And the scars pinken for probably 2 or 3 weeks, and then they fade, generally around 6 weeks. We've got a picture book in the office with hundreds of people of all sizes, shapes, and ages for you to look through. If we can help you, give us a call. Thank you.